Welcome to the Buckingham Center for Facial Plastic Surgery virtual rhinoplasty consultation. We thought it'd be a nice opportunity for us to show our patients what exactly goes on during a rhinoplasty consultation on video on the website, so you can get a general idea of how we go through things. As with all of our consultations, when you come to the office, you'll first meet with our patient care coordinator and our nurse so that we can take a medical history and get some idea of your concerns related to your nose. Following that, I'll meet with you where I can ask you some more detailed questions about both the aesthetic concerns as well as the functional concerns related to your nose. I'll then do a detailed internal and external examination looking for all kinds of issues related to the straight appearance of the nose from the front, the profile, whether it's a hump or a decrease in rotation or whatever concerns might be present, as well as the internal examination looking at the septum and the turbinates or anything that might be related to the functional aspect of the nose. Following that, the meat of the consultation as far as our conversation between our patients and myself takes place where we take a before picture of them from both the frontal and the lateral view, where we can then import it into some computer software and use the software as a communication tool for us to determine where exactly we want the patient to be. The software isn't perfect. It unfortunately utilizes two-dimensional technology, and so it's not a true representation of what can be achieved surgically, but it does give a nice talking point for us to be able to communicate what is going on with the patient. So we thought it'd be fun to go through an example of that with you here on the internet today. So this is one of our patients who came to us for a rhinoplasty, and you can actually go to our website and see her after photos and I guess compare them to what we were working on today. But her concern was primarily that she had a hump on her nose. Now, patients oftentimes have concerns that they see that aren't the whole picture, and she's a good example of that. So, she sees this, whereas when I look at her nose, I see the bump, but I also see that the tip of her nose isn't quite projected or away from her face enough, that the angle of rotation with her nasal tip isn't quite enough, and that she's got some asymmetry and some miscalculations of the way this should appear in the area of her nose underneath her tip. So we kind of go through it like this, where we grab one tool, which allows me to go in and just grab the tip of the nose, and then we can, pull it out from her face or do whatever, but obviously we kind of do it in a way that's realistic, but move that up to give her a little bit more rotation, and out just a little bit to give her a little more projection. And then we can grab another tool where we can reduce the size of the nasal dorsum and bring that into an aesthetically pleasing line. And then yet grab another tool where we can do subtle changes like affecting the way that this nostril show and the appearance of the lobule underneath the tip look. So, with rather quick, easy maneuvers, we can give a new representation of what the nose may look like following surgery and compare that to the original. Now, this really gives the patient a good opportunity for them to look at this and say, yes, doctor, that's exactly what I have in mind, or no, I'd like the nose to be a little bit more scooped out, a little more concave than that, or no, it's a little too concave, I'd like it to be a little more straight. And so that really gives us the opportunity to look at that and to compare notes and determine where the best aesthetic outcome for the patient is going to be, and also talk about how the patient's perception of where their nose may be lies in line with what I can actually achieve surgically that will leave them with a functional as well as aesthetically pleasing nose. So following the imaging part of things, we'll go through the surgical aspect, what type of anesthesia we would use, where the surgery would be performed, what the social recovery is as far as how long you might be out of work, as well as the recovery related to when you can resume normal physical activities, and also the final outcome as far as how long it might take for the aesthetic appearance of the nose to reach its final stages. Lastly, we work up a cost estimate for the patient, and at that time our patient care coordinator will come in and go over the costs with you and then take you and look at the calendar to determine if there's any sort of scheduling dates that might work out for you. So that's how the rhinoplasty consult works at our office. We hope that you find this helpful, and we'd be more than happy to have you come in and go through a real consultation with us.